Welcome to our latest community video, and thank you for spending a few minutes with us to stay up to date on things that are happening. Today, I'm pleased to be joined by Assistant Vice President of our Behavioral Health Services, Gabriel Gonzalez, who's going to talk a bit about the pandemic and mental health and how important it is that we focus on our well-being during this time. So I'm glad that Gabriel is spending a few minutes with us to be able to share his expertise with all of you. So thank you once again.
That is a very good question. The stresses of the pandemic have changed over the last 13 months. At first, we felt just worried about an illness that we didn't understand, whether it would get closer to us or not. We worried about our jobs. We worried about the economy. We worried about many a thing. Then we worried about, once the pandemic got to us, people that were loved ones who may have gotten sick or potentially died. We worried about how was that going to change our country. Today our worry is a little different. Today our worry is about, can I have access to that vaccine? What might be the side effects of that vaccine if I have it? What might happen, and how soon is this pandemic going to end? The best thing to do is to remain active. Get some exercise, maintain your social distancing, but get active. The weather is great. Find some hobbies and some pleasurable activities that will help you gain some enjoyment in life, and put some time aside for reflection. That will help you kind of get a hold of what is happening around you. Concentrate on today. Don't worry about yesterday. Don't worry about the future. Today is what you can handle. The rest is uncertain, and it can increase your anxiety. So today, what can I do that can improve and will make my life better? That's what we should be concentrating on. One of the challenges with isolation is that it creates isolation. Our brains can play games on us and develop negative emotions about why are we feeling alone, and why are people who we thought were close to us are not reaching out to us. Remember that we are all going through this, and we are all experiencing differently. In my experience, when we are the most stressed and when we say the wrong things and act kind of out of character. We need to break the cycle and take the first step on that communication pattern. You might be surprised with what you get when you take that first step, and how well received your friends and loved ones might be of you reaching out to them. These are stressful times. Give each other a chance and offer some compassion. That is important. Reach out and communicate in any way you can. I am almost certain that the other person is also having feelings of loneliness. Being secluded with family has definitely put more stressors within the household. There are a couple of things that can be done. In my experience, spending time without a purpose creates problems. So make this time purposeful. Plan some activities. Plan time away, as in different parts of the house. Plan for small outings now that the weather is great. It seems that some people have engaged in activities that they had not done in the past, but now that we have the extra time, they have invested on those activities. Things like woodworking, knitting, drawing, and other hobbies. Having fun makes the time pass faster. What is important is to remember that each person is entitled to their own opinion. It is important to agree to disagree. While it is factual that wearing a mask has decreased the incidence of flu by 98%, at the end of the day, that doesn't seem to affect our lives that much. but our relationships do, and they will stay around longer than the pandemic. So let's work on those. There are spaces where a mask is required, and we almost wear them. In other situations, it is okay to practice social distancing in that environment where we do not feel safe. Healthy conversations where both points of views can be expressed and respected are always good. If this is not possible within the conversation, then it is best to avoid it instead of having a fallout with that loved one. Remember that family and friends will be here longer than the pandemic. Society has many other impositions for the greater good that we follow every day. Most of us wear clothes in public, drive slowly near school grounds, we pay for our food in a restaurant or the grocery store. We are exposed to this since we were children, and so it is familiar to us to comply with those things. The challenge with wearing a mask is that it is a foreign concept to all of us. Who thought we would be covering our faces for 13 months? It is at the most personal. It touches your face, it changes your identity. There are many people that I met in the last 13 months that I will not recognize when the masks come off. For us in the United States, it is very unusual practice, but it's an important one. Any one of us would do anything to keep our parents and grandparents safe. I think that most people who have gotten the vaccine will show a bit of hesitancy. We don't know the long-term effects of the vaccine. There are potential severe immediate side effects, and vaccine is not available as much as we all would want it to be. I imagine that the measles vaccine had a similar reaction when it was created. Now that most people are vaccinated for measles, cases of the illness are very rare. Recognizing that there is a risk and having some anxiety about it, it is a normal reaction. The vaccine was created because this is a very dangerous illness that has taken many lives around the world and very high number of United States residents. The best way to overcome any fear is to gain knowledge about what we fear. In my experience, hitting people over the head with the information does not help. We can increase ease of access to the information so that when the individual is ready to hear it and learn about it, they can get access to it. Two things to consider when looking for information. Number one, it must come from a trusted, vetted, factual source. Number two, it must be the most up-to-date information, especially with rapid changing information like in the case of COVID-19. It is important that we look at the most updated information. I feel this way most days. Wearing a mask, socially distancing, isolating and quarantining has taken a toll on every one of us. It is a huge inconvenience. It's hard to breathe with a mask sometimes. I have to carry a mask with me at all times and ensure that it is a clean mask. If I get in my car and remember that I didn't bring a mask, I have to go back in the house and get one. It can be frustrating. Why do I keep doing it, you may ask? I am reminded of the many people who are still in danger of contracting this illness. I think about how I would feel if I was carrying the illness and passed it on to someone who died from it. What if that someone was my best friend's mother or grandmother? What if it was my own? Saving a life is worth me wearing a mask when I need to. It is about the value of my short-term comfort versus the value of a human life. I can always take the mask off at home, in my car, or when I'm alone. We are a proud country. We are a stubborn country that has shown our true grit. We are people that wake up every morning and carry on through another day looking forward to tomorrow. My grandmother used to tell me, "This too shall pass, and you will be stronger for it." I say to the people of Northwest Illinois, this too shall pass, and we will be stronger for it. We can see the light at the end of the tunnel. Keep steady forward. Tighten your belts and roll up your sleeves for the last bit of work towards ensuring we and our neighbors are healthy and can live a happy, long life.
Well, I'm pleased to share that we've seen decreased activity with COVID-19 positive patients throughout all of our communities. And I'm very grateful that as we're recording this video, it's been several days since we have had a positive COVID-19 patient in the hospital. That's provided a much needed reprieve for our very dedicated and hardworking staff to be able to take a moment of resiliency and focus on some more normal type of care. We've also been very pleased to be able to relax some of our visitor restrictions, which have allowed more people to come into our doors to spend time with their loved ones during their time of need. One of the other things that we're starting to see is people making appointments, coming in and getting their wellness visits taken care of, which is very encouraging. We know that during the pandemic, many people put some of their preventive care or even needed procedures such as joint replacements. And so people are getting those scheduled, and I'm hopeful they're looking forward to summer just on the way and getting all of those things being taken care of before we get a chance to truly enjoy the outdoors and the weather that's shortly to come. Those are going quite well. We've become very capable of being able to administer hundreds of vaccines a day in a very efficient and safe manner. So overall, that's been going great. We've partnered with Stephenson County Health Department to create one waiting list. So people are able to go onto www.fhn.org and sign up on that waiting list. And it's the only place they have to go. And as soon as we have vaccinations available, we'll be contacting individuals to get them scheduled. The waiting list works on a first come, first serve. It certainly requires you to meet the eligibility requirements for the state of Illinois at the current time for vaccinations. And once we receive shipments of vaccines and we know that we're going to have those, we contact people in order on that waiting list to try and get them scheduled so that we can administer all of the vaccines as soon as we receive them. We don't know for sure, but most likely we will, given that the Johnson & Johnson vaccine would be especially beneficial for rural populations where it's difficult to come for a second dose or a second shot. So being able to do it all at one time would be a potential benefit. But we will administer whatever vaccine that we are supplied with through the state of Illinois. Well, certainly with having the supply of vaccines is critical to being able to create those schedules or to be able to get people in. When we have different types of vaccines, whether it's 1 dose or 2 doses, and even with the 2-dose vaccines, there's some differences in the scheduling. One is 21 days for your second dose, and the other one is 28 days for your second dose. So we've become really proficient in being able to schedule those doses that are needed if you do require a second dose, or certainly if you're able to receive the 1-dose vaccine, then that makes it even easier because there's nothing left to schedule. They will not, and unfortunately, we don't know exactly which doses we're getting when. We just want to be able to get those to people as soon as possible, and it really doesn't matter. All of the vaccines have been tested for their efficacy and their safety and provide good protection for our community members. So regardless of what vaccine we're able to administer, they're all very good at protecting our communities. As we've talked about before, is to be patient, but also to take some consolation in looking around and seeing how our weather is once again welcoming us to the outdoors. We've seen many of our local businesses starting to open up once again, so let's get out there and support those and do it in a safe manner and really be focused on a lot of optimism of what's coming. It's hard to believe that approximately this time last year was the start of the pandemic. So we've been a year through this, and it's looking much brighter today than what it was looking just a year ago. So keeping focus on that optimism and looking forward and being grateful for all of the things that we're starting to be able to do once again, while maintaining that safety awareness is going to be critically important for us to successfully be able to make it through. There's good information out there that our supply chains has been strengthened and that we will be receiving much more vaccine as we move through the next several weeks, and that will be creating a condition where hopefully by summer we'll be able to vaccinate anybody who wants a vaccine.